Now we will discuss about the stroke by anatomy. Very important. In case of stroke by anatomy, we have to know about the different areas of the brain and the blood supply of the brain. We have discussed about the blood supply of the brain of our previous lecture, and with this help of the lecture, you will know in very clearly in this topic. Okay. So in case of blood supply of brain, we know that the medial portion of our cerebral hemisphere is supplied by the anterior cerebral artery. This blue area is the territory of the anterior cerebral artery. So this anterior cerebral artery will give blood supply to the medial surface of the cerebrum as well as some lateral portion also. You can see this is the lateral area of our brain hemisphere, and in the upper portion the blue area is also supplied by the anterior cerebral artery, and also in the medial portion is mostly the medial portion are supplied by the anterior cerebral artery, and this reddish area of the lateral part of the cerebral hemisphere is supplied by the middle cerebral artery, and this yellowish area is supplied by the posterior cerebral artery, that is the part of the posterior circulation. So now come to our point. So if you think about the homunculus of our brain, this is the homunculus, that means the part of the brain that is the regulated by our regulate the our different parts of our body. This is called the homunculus. If you think this homunculus, I have draw it just like this. So if you place a human in reverse position, then it will fit like this. So you can see here, this is the lower limb and this is the upper limb and face. The lower limb part is supplied by the anterior cerebral artery, you can see here, but the body and the upper limbs and also face area, this is regulated by the area that is supplied by the middle cerebral artery. So suppose a patient has only anterior cerebral artery thrombosis or occlusion, then only lower limb part will be involved and it will get paralyzed, but the upper part and body and upper limb will spared, right? But in case of MCA, that means middle cerebral artery territory stroke, if the total area or total occlusion of middle cerebral artery, then it will involve the area that will regulate our the body and upper limb portion of our body. So in that case, the upper part or upper limb of one side and the body will be paralyzed, but the lower limb wouldn't get the paralyzed because this lower limb portion is supplied by the anterior cerebral artery. So in that case, our only upper limb will get paralyzed unilaterally. Okay, but you can ask me that in our clinical presentation of in our ward, actually we get the hemiplegia, that means total one part of our body is paralyzed. So how can they occur? In that case, actually when this part like the anterior cerebral artery territory part or the middle cerebral artery territory part, the motor fiber from this part will get compact together, and by forming the corona radiata, it will pass through the internal capsule. So if the internal capsule is blocked or internal capsule area is infracted, then the total this motor fiber that coming from this the MCA territory or ACA territory part, all the fiber will be lost. That's why we get this kind of patient in our body, in our ward invariably, because that internal capsule area is supplied by the lenticulostriate branch of the MCA artery. And you know that the lenticulostriate artery is very narrow artery, and also it can be easily blocked by any condition like if the patient has diabetes or hypertension. For this reason, this blockage or the infracted area of the internal capsule, the presentation of stroke is very common in our clinical practice. But if the patient has solely this ACA territory attack or ACA territory stroke, then only the lower limb will be involved. And in case of MCA territory, if it is solely MCA territory stroke, then only the upper limb and body area will be paralyzed. but the leg or the lower limb will be spared. So this is the basic anatomy or basic thing for this region.